Good afternoon. My name is Derek Davis, and this is a presentation for the microbiology case study. So getting started, here's just some background on the patient that presented. We had Jude, who was a 25-year-old social media influencer, and her page is dedicated to promoting stray cats and kittens to help them find good homes. So we have our patient here, and every year she does a calendar, and it's called Kittens for a Cause. And it's where they highlight 12 different cats. The idea is to get these cats adopted and just really show these cute animals. So while our patient was doing the photography for her Kittens for a Cause calendar, one of the kittens happened to reach up and scratch Jude on the neck. This occurred during the photo shoot. They were in the process of shooting, and yeah, like I had mentioned, the cat reached up and just a big scratch down Jude's neck. And some more background here. So our patient presented to the Cleveland Clinic, and she had a fever. She had an inflamed scratch on the left side of her neck, as you can see here. She also had some pus. She had pain in her left arm, and just a general feeling of fatigue and a general feeling of kind of illness. And the kitten here that scratched Jude was from the October page that scratched Jude on the neck. And, because it was October, it's very close to the end of the year. So Jude was really just excited to get the calendar finished. She was in the zone, didn't want to stop. So she never cleaned the site of the scratch. She never cleaned that infection site. So she kind of just put it off and kept moving forward. And just to be honest, didn't really think about it afterwards. So after about 4 days from that scratch, Jude noticed she was starting to feel some fatigue and just some discomfort. And then after 6 days is when she finally decided to go to the Cleveland Clinic. So what did they find at the clinic? What were some of the physical and laboratory findings? Well, her vital signs initially at the clinic, she had a blood pressure of 137/88. So she had higher blood pressure. Her heart rate was 104, which is a little bit elevated out of that normal range of 60 to 100 that we'd like to see. She had a fever, so she had a temperature of 102.4 degrees Fahrenheit. Her respiration rate was 19, so a little bit on the higher end. Typically, we like to see 12 to 20, so that was a little bit higher there on the respirations. And then she had a pretty good oxygen saturation of 99%. Now, for the specific site of infection, they noticed a bright red scratch on the neck. That scratch was filled with some pus. And then the lymph nodes, it was noted that they were inflamed and they were tender whenever the physician would palpate the neck. They were tender to the touch for the patient. So they did some tests. Because of that elevated heart rate, they ran an EKG, and it was unremarkable. There was no findings on that EKG. Because of the pain in the patient's arm, they did an MRI just because they thought there might be some structural damage. But after doing the MRI, it returned negative. So there was no structural damage that they were able to find. And they also, because of the inflamed and tender lymph nodes, doctor took a biopsy of that lymph node, and it did return negative for cancer. So they proceeded with some additional tests here. So they tested the blood, and they saw that the white blood cell count was 20,000 per unit of blood. So that's high. So it showed that there was some sort of infection in the body. When they took a tissue sample, they noticed an organism that they saw was, they did a gram test, and they noticed that it was gram negative. And also the organism was rod shaped. And then they also ran another test called the indirect fluorescent antibody test. And that test showed the presence of Bartonella antibodies. So that really helped them kind of narrow down what they were looking at with the patient here. So what they determined was that the organism that they identified was called the Bartonella henselae. and that's a bacteria that causes the disease that Jude presented with. And some additional information about Bartonella henselae. It's a gram-negative aerobic bacillus. And then the disease that Jude presented with, it's a bacterial infection caused by the Bartonella henselae, and it's spread by cats to humans through scratching or biting. Some common symptoms of this disease include fever, just a feeling of just illness or fatigue, and localized swelling just at that site of infection. Pictured here, you can see the vicious creature that caused this disease in our patient. So the life cycle of this disease. So first, the cats acquire the bacteria that causes the disease from fleas. So the fleas pass this bacteria on to the cats, and then the cats give the disease to the human. So the cats in this case are the vector for this disease. And the thing about the infected cats is you're not able to tell that they're infected just by their general presentation. So the cats are going to appear asymptomatic. So you wouldn't initially think to get them tested because those cats, such as the one pictured here, are not showing any sort of symptom of a disease. So when the cats, when they spread the disease, it's either through a cat bite, through a cat scratch, or infected saliva is transmitted. And 56% of cats with bacteria that cause the disease are under the age of 1. So you'll see the majority of cats that pass this disease along are kittens. So next here, the disease, the treatment of the disease. So oftentimes the cases may be pretty mild. So you're not always going to need, real like doctor prescribed treatment. It can be as simple as applying a warm compress at that infection site, combining it with some over-the-counters that are going to help with the fever, help with that inflammation. They're not always going to be a prescription medication needed for the patient. But in our case, we had our patient, she was informed of her diagnosis and sent home both on the same day, but she was prescribed a medication here. And she was prescribed, it's called azithromycin, and it's an antibiotic. And because the patient weighed 50 kilograms, the doctor decided the course of treatment for Jude would be 1 day of 500 milligrams of the azithromycin. And then for the following 4 days, 250 milligrams of azithromycin. So the outcome, Jude finished her treatment, all 5 days. And she noticed that over the course of several weeks, that scratch completely healed. The energy levels previously were pretty high before the infection, and her energy levels did return to baseline, so she got her energy back. And all the other signs and symptoms were resolved and taken care of. And because of this, Jude vowed to take more precaution with handling cats, and she even partnered with some local clinics to provide diagnostic testing for the rescue cats that she was putting up for adoption. So making sure that no cats that were given to good homes were infected with this disease. And this disease, as you may have been able to tell by the presenting symptoms and vector, is cat scratch disease. So our patient Jude, when she presented to the Cleveland Clinic, it was determined that she did have cat scratch disease. Thank you.